Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today on the show, we have Naila Russell. She is a nurse practitioner. She wrote the Kevin MD article, A Call to Dismantle Structural Heteronormative Care. Naila, welcome to the show.
Thank you for having me.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Absolutely. So I am a nurse practitioner. I practice in Maryland in dermatology, and I like to share my experiences in practice. I also am a director for a family nurse practitioner program where previously I taught in our health policy courses. And one of the things I stress to my students is that nurses need to be sharing their stories and advocating for change. So everything I write is really a reflection of those experiences where I see structural issues that I'm hoping to change and that I think nurses and other healthcare professionals need to be thinking about and working towards changing.
So give me an example of how you or one of your nurse colleagues did share their story that led to making a difference.
Sure. So we have students who write opinion pieces and they, are required to not all the students, the doctoral level students are required to submit them to their local newspapers. And a lot of times they'll weigh in on things such as legislation that's pending that is healthcare related. And those are huge. Our local legislators, our state legislators, they do read their local papers. They want to know what their constituents are thinking. So that is certainly a way. I do the same. I'm the president of the Nurse Practitioner Association of Maryland. I'm active on our legislative committee. So I use that as a tool to call attention to the legislation that's being passed and then, testifying on the legislation and connecting with those legislators. And that's what we teach our students to do too, because there's a lot of power in those opinion pieces.
Obviously, I talk to healthcare professionals all the time, and I essentially share similar advice that we can use these platforms to share our voices and make a difference. But I certainly want to hear just from your perspective. Can healthcare professionals, can they really make a difference when it comes to legislations by making their voice?
I think so. I guess I can give you an example of just this year in the legislative session in Maryland. And, this may not seem like a huge win, but it absolutely is because of the impact it has on real patients' lives. We had a nurse practitioner who came to us and said, did you know in the state of Maryland, a camp nurse who's a nurse practitioner cannot prescribe EpiPens for the campers, which is obviously problematic because in the state in general, we can prescribe EpiPens and, teach our patients how to administer them, et cetera. So, what happens then when a child is at camp, gets stung by a bee, has an anaphylactic reaction, but the refill wasn't called in because physicians are really busy. And this was just an example of legislation or regulation that hadn't caught up with the reality of the times. And there's all sorts of laws like that. Nurse practitioners have had full practice authority in Maryland since 2015 and prescriptive authority way before that. But so clearly this regulation was just old and outdated. And he had a patient who experienced an anaphylactic reaction and he had to make the decision of, what to do in that time. Fortunately, even though there wasn't a prescription, there was an EpiPen available. He was able to administer it and kind of go outside into that gray zone of, what do you do in this situation? So he brought this to the legislation. We found sponsors, we brought it forward. The child who had the anaphylactic reaction shared her story, came to the legislators, testified, as well as the nurse practitioner. And the law was passed unanimously. And so now that's no longer going to be an issue for children in Maryland. And those are just the crazy things that exist, but a huge difference for the lives of kids who could be affected.
All right, let's talk about the Kevin MD article that you wrote. It's titled, A Call to Dismantle Structural Heteronormative Care. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
So this is a story that I've wanted to write for a while. I just never had the time. It actually happened last fall. It was a patient encounter with somebody who had come to our office before I had never seen. And she was interested in starting oral isotretinoin, which is a treatment for acne and requires quite a bit of legwork in order to take. So when we met, I was already kind of, my MA had put me right for going into the room and said, oh, this patient wants to take Accutane, which is the brand name. We no longer call it that. And said, but their acne's not that bad. And I'm like, okay. So I was already kind of like biased and had preconceived notions before even going into the room. And when I went in, I kind of looked at her, said, okay, let me see. And it really wasn't too severe, but, it did meet requirements. She had been on it in the past and really wanted to go on. So I'm like, okay. And I felt like I was kind of on autopilot at that point, where then I launched into my story about like, okay, well, this is all you have to do in order to be on it. And what quickly happened is I said, the FDA monitors this. You need to be on 2 forms of birth control, and these are your options. I said most people use male latex condoms as their second choice. And, I could tell that she was getting kind of agitated, and I wasn't really sure why. And I'm like, so what are you going to do? Like waiting for her to let me know. And she said, well, there are other options. And I was like, very offhandedly said, well, abstinence is an option, but we don't recommend using that. So finally, it comes out, she tells me that she's gay. And I was absolutely mortified because I hadn't even considered that, in my discussion with her about the requirements and everything that she had to do. And as somebody who I would say in general, I consider myself to be open-minded and inclusive, but, it was just a reflection on, wow, I came into this room with these preconceived notions, my own, life experiences, and projected it all onto this patient in front of me. And then kind of taking a step back and being like, well, first of all, I've never been in that situation in dermatology before. And second of all, just the fact that the system doesn't really allow for that type of a patient. Like there's no workaround when somebody tells you, yes, I have childbearing potential, but I don't have sex with, males. So it's like, okay, what do we do? And she really quickly called me out and was like, well, that's very heteronormative. And I was like, it is heteronormative. And I was really just kind of shaken with how to move forward with this visit, because how important it is to establish that trust and have patients have confidence in you. And it was really quickly just deteriorating right in front of us. And eventually, we came to a determination that she would pledge to abstinence, and what that means in iPLEDGE. And then, still, oh, but you still need to do these pregnancy tests. So I need you to give me this pregnancy test. And she's like, well, there's no way I can be pregnant. And I'm like, again, iPLEDGE does not allow for us to say that there's no way for you to be pregnant. So she's like, okay, I'll do it, whatever I need to do in order to get this done. And we kind of left it at that, but it was probably the most dissatisfying patient encounter I've ever had. And I just knew that I had to know more about this. Like, was anybody talking about this issue of iPLEDGE and how it's not really very inclusive? And there are people who talk about it. There's been some articles, there's been some opinion pieces, and there has been some change. So even after this had happened, as of December, there's now more gender inclusive language in how iPLEDGE is utilized, but it still doesn't really account for the patient who is a cisgender woman having sex with a cisgender woman. So I think there's still a long way to go. And I promised her before we had left, I said, I hear you, and I'm going to do something about this. And for me, that meant like, I have to share this story, even though it's not a good reflection on me as a provider, but I need to share this so that people are thinking about it and they're talking about it. And so that's why I wanted to write the piece. It's just really, this is a structural issue. The system that we work within doesn't recognize her and her unique situation and her life. So I've done a lot of research on structural racism in nursing and healthcare, which I was inspired to complete after the death of George Floyd. And, talking about structural racism, I think, is much more normal now within healthcare, but nobody's really talking about it as a structural heteronormative lens, which it certainly is. And I couldn't even find like a term, is this something people are saying? And so I felt like I was like, I'm just going to call it structural heteronormative. And I don't even know if that's a thing, but that's what it felt like to me. And that's why I wrote the piece, because I promised her that I would do something. And I was so so just uncomfortable and
Hmm.
dissatisfied with the entire encounter.
Now, for those who aren't familiar with what iPledge is, just briefly share with us what that is.
Yes, sorry. iPLEDGE is a system that is used to assess risk for patients who are prescribed oral isotretinoin, which is an acne medication. And the reason is because that oral isotretinoin can cause birth defects and spontaneous abortion in people who are pregnant. So ultimately, iPLEDGE states that the goal is to prevent pregnancy in people who could become pregnant taking isotretinoin, and to prevent those who are pregnant from being started on oral isotretinoin. So that's the ultimate goal. It's very, very, I mean, if you don't do all the steps in iPledge, a pharmacist can't even dispense you the medication.
Hmm.
So it's very by the book. There's no gray within iPledge. And, sometimes we need a little bit of gray, but then there is none. So we have to just make it work, which is what
Sure.
we had to do for this patient.
Now, you mentioned that since this story, the wording in iPledge was a little bit more inclusive. How does one
Yes.
even go about changing some of the language in iPledge?
Well, I think it was something that came about because healthcare professionals were talking about it. They recognize that we need to have gender affirming systems and structures like iPledge. And it just really didn't account for those people who were transsexual. A trans man who still has reproductive potential, needs to be put into one of these categories. And so it used to be three categories, and it was like basically males, females of reproductive age, and then females who had had a hysterectomy. Basically, those were the three options. And so now it's just those who can get pregnant and those who cannot. And iPledge does provide language for providers to say, like, these are people who can get pregnant and these are people who cannot. And that was seen as a big win for healthcare to really have this gender affirming system.
Hmm.
So, and I do believe that did come from, physician groups, making a stand and saying this needs to change. So, like I said, when I had done some research after this encounter and I was so mortified, I did find that people were talking about it.
Okay.
And the FDA started making the change or talking about the change in 2018. And it wasn't until 2021 that it actually went into effect. So these things take a really long
Hmm.
time, but that's kind of the process that it went through.
We're talking to Naila Russell. She's a nurse practitioner, and she wrote the Kevin MD article, A Call to Dismantle Structural Heteronormative Care. Nyla, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So I just want to leave with people thinking about the LGBTQIA plus community. I think it's important as healthcare professionals that we do recognize the importance of seeing the patient who's in front of us. So number one, checking our own implicit biases, reflecting on what those are. We're all going to make mistakes because I'm somebody who developed curriculum for my school on an implicit bias, but I still had this horrible, dissatisfying patient encounter. So we need to share those mistakes and we need to feel okay talking about it. And if we have the power to change it, to do something about it, because change can happen and it only happens when we have these conversations. I also would like to just acknowledge that in 2022, there's already been over 240 laws brought into state legislators, into their houses that are related to the LGBTQIA plus population. And the majority of them are to take away rights from that population, including the rights of healthcare professionals to provide gender affirming care. So, that's something that we have to be thinking about and know about and talk about, and certainly make our opinion heard, because it's not okay. These are our patients and we will be encountering them in the care that we provide. So I think just knowing that we can make a difference is so important.
Thank you so much for sharing your story time and insight. And thanks again for being on the show.
Thank you.